Okay, it's 12 o'clock in Korea, so let's get started sharp. Hi, everyone. Thanks for joining the call today, as usual, what we do every month. I hope you all have a wonderful week, by the way. And for today's agenda is, of course, Odyssey News, and we're going to share 2026 Odyssey APAC regional updates. And finally, we have some of the value study results. So we're going to do the interpretation. Yeah, and let's get started. So, few news from the Odyssey. The Common Data Model Working Group has been planning like a CDM version 5.5 for like a over the last 18 months. I heard, and the development version is now available for the review. So, and please take a look. And they are waiting for the feedbacks and tests in your environment. So, yeah. So scan the code right down there. And another news is the CDM survey subgroup has published its protocol. It's called Best Practices for Mapping Standardized Assessment Instrument Data to the OMUP Common Data Model. So I know there is a working group of the survey, and I kind of briefly review the protocol, and they've done their job very thoroughly. So please, guys, go to the protocol, and if you have any ideas, you can review too. And as I mentioned last month, Peter Hoffman from Data for Life team, they provided a preview of Atlas 3 demo, and it is now live, and discussion and feedback are welcome too. So I just left the relevant links in the chat that Jack, that accidentally made Jack to join the call early. So for everyone who wasn't able to scan the QR code later, you can just check the chat and you'll find it easily down there. And yep, of course, we have 2026 Odyssey Global Symposium at October 20th to 22nd. I heard there's a less than 10 rooms are available right now. So if there's someone who hasn't registered yet or booked the hotel, you have to be hurry. And yep, and also, um, so the Odyssey Titan Award is it's served to recognize those who have not gone of the beyond to foster community engagement, who has lead the research and development efforts, and some of whom made a significant contributions towards Odyssey community. So they are doing this every year through the symposium, and nomination due date is on September 22nd. And I mentioned several descriptions of the Titan Awards, and last year we have like several institutions and teams and individuals who has been nominated in this of the Titan Awards. So I really hope there will be a lot of APAC collaborators this year too. Oh, and the winner will be announced at this year's Odyssey Symposium too. And of and next is Odyssey APAC Symposium again. We have an official website for the Odyssey APAC Symposium. So it is finally live. So you can register directly through the site now. And the site link is on the chat right now. And you can just hit the link and go through the website now. So feel free to sign up whenever you get a chance. And one thing to keep in mind is the early bird registration runs until September 30th. So if you're planning to make it a travel or come over to Korea, it's worth getting it done before then rather than waiting until the last minute. Yes, Morning, your hands are raised.
No, I'm not sure. Is it because of me? I actually can't see the chat. It could be my login issue, I guess.
Oh,
Because you were referring to the
hold a
chat.
second. Hold for
Probably
a second.
I was using a different account, I guess.
Oh, maybe that's why. Are you using a guest?
Yeah, probably, yes.
Oh, that's why.
Okay,
Yeah,
okay.
Chan.
I just please note that the number of participants for tutorial and datathon are limited. We only have 50 up to 50 people in tutorial and datathon. So please don't hesitate to register.
Yes, please don't hesitate to register. And as Chan mentioned, Datathon attendance is limited to 50 participants, and we are preparing various of data that we could actually use, and maybe people might interested. So, yep, that's it. And also, the tutorials and Datathon are a parallel session. So, if you want to, you cannot do the both. You can just choose one, and yeah, and that's it. And actually, for the Datathon registration, you have to go to the registration here at the website, and there will be a tutorial or Datathon checkpoints here. So you have to click the one that you want to join, and that's it. And and of course, the APAC Symposium showcase about the abstract. The deadline is August 23rd, EST. So it will be 24th morning in APAC region. So you have to tune for that too. Yep. And up and next is 2026 OHDSI APAC regional updates. And I made it a bit epic today. So as many of you guys know, as of 2026, OHDSI APAC community has grown to 11 countries. And I think it is fair to say we are on this OHDSI together. So every year we set aside a one session for each country to share the where they are, where they stand, and what has been achieved, and what is like underway, and what is coming next. So let's begin in the 2026 mid-year update from across APAC. And since even though we have like 11 countries, but today we have only 7 countries who are ready to share their updates. Yeah, so before I get started, each regional chapter has like 3 to 4 minutes since we have a time limit. So yeah, and before also I would like to request the if you, even though you have a question, you can just keep it for the later. And you can just leave a chat, or we'll get the questions or comments at the last minute, after we finish all the regional updates. And let's start with Japan, because Keiko asked me to request me to to put her down in the first present. Keiko-san, if whenever you're ready, you can share your slide.
Yeah. Can you hear me?
Yep, I can hear you.
Okay. Just a moment. Can you see my slides?
Yep.
Oh, but just a moment. So this is not the presentation mode. Okay. Right. So this is just a brief update from Japan chapter for the 2026 first half. So my name is Keiko, and I'm just summarizing what's happening in Japanese chapter. So first, activities achievement. Would like to highlight some of the achievement. First, as a community contribution, a Japanese team teamed up by Mr. Inoue and Dr. Kimura won the third place at the Mind Meets Machine competition at the EU Symposium, and that was an AI mapping contest for the vocabulary. So we are very proud of the team's contribution and achievement. And the second one is Atlas 3 internationalization, and we have more like an open source software contributor, Mr. Wachi, who has been continuously contributing to this effort, and particularly for the implementation of Japanese localization. And the third one, OMOP adoption in internet by Dr. Oyagi, and OMOP adaptation activity made publicly in GitHub. This initiative is for the National Core Research Hospital Database Network, and you can find the details in the link. And some other research publications and data infrastructures. We had a few achievements. Ministry of Health and Welfare funded a research project led by Dr. Yamashita is ongoing, and this is about research on conversion of government medical data, including national database. And a new project, collaboration with Link for the health checkup cohort, led by a group or Dr. Hiramatsu, and they plan to have federated analysis. And publications on data code mapping for the Japanese system, what we call the MEDI standard disease name, which is used for the claims data in nationwide. And the mapping using through the ICD-10 code was published in Journal of Medical Informatics. And expansion of commercial OMOP databases. So this is more like commercial activities, but still we consider the community enhancement. And the JMDC and Desk Healthcare were added to the commercial OMOP database portfolio in Japan, alongside preceding IQVIA and Medical Data Vision (MDV). So, in summary, broader availability of Japanese real-world data in OMOP format, or some new projects are ongoing. Some other education and community outreach activities are still also presented here. So OMOP CDM course at the University of Tokyo, led by Dr. Okada, was conducted in 90 minutes practical session using OMOP CDM as a part of the human capital or human resource development project. OMOP webinar series are also organized by JMDC and Unity. Also, IQVIA developed the OMOP e-learning platform, which covers OMOP CDM, vocabulary mapping, ETL, DQD, Atlas concepts, and tool, which is a structured learning path available in Japanese for the practical implementation to support OMOP workforce development. So lastly, this is our community activity, OHDSI Japan community activity, and we have monthly regular evening conference continuously. And the program usually consists of Journal Watch, OHDSI Global APAC updates, and the featured topic. And here is a list of featured topics, wide range from LLM to more like practical e-learning system introduction or internet that we just covered. So that's it, brief, but we are slow but maybe steadily making progress. Thank you.
Thank you, Asao-san. So, as I mentioned, if you have any questions, I will pick it up in the final few minutes. So, if you have any feedback or questions about Japan, chapter Japan, just leave it in the comment.
I would say that Japan is not really slow. It's very amazing achievement you've done. Yeah, congratulations once again.
Thank you very much. Very nice.
Thank you, Chan, for the compliment. And next morning, go ahead.
Okay, so yeah, a quick update for the Singapore chapter. A few things has happened. Yeah, the biggest movement initiation is that we set up a Singapore OMOP committee of practice. The aim is to basically encourage both the domain experts, data engineers, physicians, and researchers to get more involved in the Singapore chapter. And the four main pillars we focus on physician, researcher, community building, more cross-disciplinary collaboration building, more involved in international OHDSI studies, more structured education and training programs for Singapore and APAC. Also agentic AI ready analytics with the OMOP common data model. It was led by me, Niam, and Mukesh. In phase 1, we are formally launching it in 2026 September during our APAC symposium. So we definitely we have invited our government officials for our National Research Foundation to kind of present that idea as well. And in long term, we continue to develop Singapore talents and our research programs to blend in better with the OMOP ecosystem. Here are some technical work groups we have. I won't go into the details. And along with the committee of practice, as mentioned, one of the things that we're going to strengthen the structured education. So in National University of Singapore, the support for many of the country chapter leads, we set up a professional certificate on OHDSI common data model and data analytics. And we kind of soft launched it in Malaysia, along with the Malaysian chapter launch as well. And thanks Stephen and the Malaysian chapter for hosting us and allow us to soft launch there. And in terms of research, 2 studies we are focusing on. One is continuing our GLP-1 study led by Evelyn. We already have some preliminary results. But in the next phase, we want to expand beyond the original cohort and want to recruit more cohorts from Asia, particularly. And we add in a new comparator, SGLT2I as well. And we refine the definition of the cohort as well. So, and here is the updated. You can scan the QR code for the updated GitHubs and everything. If anyone interested to join us or anything else, you can always email me or drop an email to Evelyn. Moving on, second study we are looking into is through the GLP-1 study. We noticed that a lot of the cohort extractions and also the sort of the robustness testing tools were developed based on the characteristic of the North American data sets. And for example, the GLP-1 study, that we noticed that once we apply all these tests, majority of the North American data sets will fulfill and pass, but only the Japanese cohorts kind of survive, and many of the cohorts in APAC fail, and the EU data set fail as well. So we noticed that maybe some bias in some of these methods or some different characteristics in different regions that we may not have been accommodating while designing many of these studies. So we are conducting a meta study to explore that and to see how we may refine all these study packages in OHDSI, so that the more APAC and EU data sets may be involved in the study as well. And same thing, feel free to join us. We have a code here, and for anyone who want to join and scan the QR code to look at the GitHub, or as usual, anything, they may email me or Evelyn, who's leading the study. Moving forward, thanks to my student Yun Yue, we set up a LinkedIn OHDSI APAC page as well. While all the events, feel free to send your poster to us. Yeah, we already have posters about our APAC symposium in Korea and the upcoming ones in Taiwan and the one in KL as well. So any updates or updates of studies, feel free to share with us. We will post it on our LinkedIn. Also continue to support our partners in APAC. This was a meeting in KL again this month with the Malaysian chapter chair, Professor Datuk there, and the president of ASM from Malaysia. And this was us gathering at the launch of the Malaysian chapter. Too bad Stephen wasn't in the photo because he was busy hosting the event and entertaining everyone. But the little piece that Moy hold on, is the draft of the APEC Symposium agenda that we work out before the dinner. Okay, so all the science happens on a napkin. Okay, that's about it, and hope to do more in the second half of the year. Okay, cheers.
Thanks, Wardy. Yes, every scientific results and findings come from the napkin. That's agree with you. And next we have yeah, Jason. Thank you. Oh, what Jason, are you
think-
muted?
Sorry about that. My camera doesn't work. Can you hear me?
Yeah,
Yeah, I can hear you,
good,
but
good.
your screen.
Yeah,
Yes, yeah,
your slide right now. Yeah,
yeah.
great.
Thank you.
Okay. Here are the members in our secretary in OHDSI Taiwan Society. Most of them are my students, and then all of them are very interested in OHDSI study. And here are the members from different university, hospitals, and industry companies in Taiwan. And so you may know that we developed a system, a product to automatically convert the data format from NHI, National Health Insurance format, and FILE format to OHDSI, and we also applied this as a domestic patent, and to promote this system to every hospitals in Taiwan. And we hope that we can encourage all medical centers in Taiwan to get involved in OHDSI data. And so far we have totally 8 hospitals. They have already adapt the OMOP common data model, and then we recently we applied for some grant from the government and then to support us to promote the OHDSI format and also MediPlug system. And in this year, we get involved in some international cooperations projects, and fortunately, we have some publication. Like the first one was published in HACC, and the second one from Europe. And totally, we have 3 publications this year, and we also co-work with Nico from Australia, and then to propose the project APAC value study protocol. And later on, Nico is going to present the final results, preliminary result about these projects. Thanks, Nico. And in April, we also attend the OHDSI Europe Symposium, and we learned a lot from Eden. And then we hope that we can learn from them and also do the Titan in Taiwan later on. And also in May, our team went to Columbia University to visit Professor George Hubset, and then we have a very good discussion about how to work in OHDSI in Taiwan, and Professor George also gave us very good suggestions to this. And we also thanks Professor Yong Chen from University of Pennsylvania, and then we have a good interaction with them, and we share our experience and also learn from their lab. And some of their students, Professor Yong's students, are also tell us about the very new technology to work in the future for OHDSI. And in May, we also attend the eSport global meeting, and then some of our poster presentation are about the OHDSI, so we can use this opportunity to promote OHDSI as well. And we also have a chance to have a discussion with the government and national health insurance, and then we hope we can have a future cooperations together in the future. And now we are going to initiate a proposal and for future collaborations. and some promotion in academic field, like some university in southern Taiwan, and also a research institute in Taiwan. And also thanks Malaysia to invite us to share our experience from Taiwan, and this was a very good, wonderful conference. And then finally, we just host the Health Data Science Global Summit Forum in Taiwan, and especially thanks Louis, Danny, and Chen come to Taiwan to participate in this forum and also be a presenter, okay, in our conference. That's it. Hope we can have a Titan in the near future, and then we can work together in the future with all of you guys. Thanks.
Let's go Titan. Taiwan, you guys, the team is all over the globe. Yeah, that is really impressive. And thank you, Jason. And next we are having we are Korea, Chungsu.
Oh, okay. I can share my screen.
Thank you.
I just discouraged because Taiwan have so many progress. So I don't have too many things to present or work. So yeah, this is a Korean chapter mid-year regional update. Oh, can you guys see my screen, right? Okay.
Yep.
So just for give you a reminder for the APEC symposium, because Jiwon already mentioned that about it, but for today, the problem is the number of abstracts submitted is only 7. So we need 2 more abstracts. We need 2 more abstracts submitted. So if you have anything to submit our symposium, then please submit it until this week. So I'm also prepared one. So if you have anything, just submit it then. The second update is our national claims data source covering whole Korean population called HERA CDM. We published the new HERA CDM profile paper in the IJE, International Journal of Epidemiology. So the main update was the vocabulary updated, and we also introduced the new pharmacy dispensing data, because before then we didn't have a pharmacy dispensing data in that data source. So we introduced new data in that source. And with HERA, our team is also discussing about linkage with the EHR data and claims data based on the OMOP CDM. So this discussion is actively underway. HERA is really pushed forward with their database. So this year, a pilot, HERA started to operate a HERA CDM center to improve data accessibility. So it will allow Korean researchers to directly visit their centers to conduct their own research. Before that, HERA CDM analysis was only accessible through the assistant of HERA staffs as the distributed model, but they feel like many researchers in Korea feels inaccessible for that way. So HERA decided to open their data via the CDM center. They also consider the regional accessibility as well. So they opened multiple centers in Korea located across Seoul, Suwon, Wonju, Daegu, and Busan. And they are really considered make it official. So official full-scale operation of this HERA CDM center is planned for the near future. And OHDSI Korea chapter is always accompanying with the clinical and regulatory society. So for this year, we also participate a number of clinical society because they hosting sessions or tutorials related to the OMOP in their own conferences. For example, Korean Academy of Medical Sciences, Korean Society of Epidemiology, Korean Endocrine Society, Korean College of Clinical Pharmacy, and so on. So yeah, this is a very encouraging news because they feel like the OHDSI and OMOP is really important, their research. So we are really feel happy about it. And OHDSI Korea is also working with the regulatory side as well. For example, we are developing real-world data, real-world evidence guidelines for the regulatory purpose in Korea with Ministry of Food and Drug Safety. So I intended to include some description of the OMOP common data model in their guideline, especially for the EHR analysis part. And for the research side, I feel the emerging research area in Korea is obviously leveraging agentic AI or LLM system for the OMOP studies. I know the Chan already published a paper called From Study Design to Executable Code in JAMIA Open, but I know that some other people's, including Donga University or in our team also, have some work on this approach. For example, automated target trial emulation. And for myself, I'm developing an agent AI system for the negative control outcome selection. Finally, we have some congratulation news because Professor Weong Park in Korea chapter, he received a commendation from the Ministry of Health and Welfare because that department recognized a pivotal role in the implementing the OMOP common data model in Korea, and also especially adopting the HERA's national OMOP common data model, so which make our Korean researchers enable to analyze the whole national data. So congratulations. Yeah, that's it. Thank you.
Thank you, Chelsea. I was like laughing all during all your presentation because Mui's comment was so
Okay, I have to
funny,
see that
but
comment.
yeah. You guys are all boasting about how your achievements here.
Yeah, it's nothing compared to any of the other countries. Come on.
So yes, apparently we are making a huge progress, but really quietly. So, but it's real. But okay, and yeah, that's great. And next we have Australia. Nicole, whenever you're ready, you can share your screen. Thank you.
Okay, you see my screen? Yeah, great.
Perfect.
Yep.
Okay. Again, there's been so much amazing work happening across all of the different chapters. It's just really, really amazing to see. So yeah, again, like you, Chang-Soo, I feel terrible following you as well as Taiwan. It's a bit unfair. But anyway, the Australian update. A lot of the work that we've been doing across Australia is obviously very, very dedicated towards the ARDEN initiative, so the Australian Health Data Evidence Network. We have I'm just going to go through. We have 5 different work packages that we are progressing through the project, and they're around first the data, second distributed research, third is around capacity building, fourth is around building federated services for Australia at large. And then fifth is really that policy and advocacy work where we're really trying to uplift you know, the use of OMOP and the value proposition for why we do the work that we're doing and what it means for healthcare improvement in Australia. So in terms of the data work we're doing at the moment, we are progressing. We've got 5 states now who are working towards their ETLs in various different stages. And what we're really focusing on at the moment is collating those ETL documentations and vocabulary mappings, and really trying to kind of understand and standardize the mapping across Australia and the different states. In particular, on the right-hand side there, I've got some of the activities that are front and centre for us at the moment, and specifically for Australia. And there's 2 things at the moment: Indigenous status and Indigenous sovereignty in Australia is a very important topic, and we're working hard with a series of consultations to identify appropriate translation of Indigenous status here in Australia for use at the national level. We're also working towards generating a synthetic data set that is going to be appropriate for use in Australia. It has Australian characteristics and keeps the fidelity across time as well. So that can be used for generating analyses and testing of code, but also, returning good Australian specific data for, validity testing and so on. In terms of the research we've done, and I've got a slide coming up about some of the use cases that we have decided to work together on. Each of the states are running or leading a use case that will be used as a distributed study. What we're working on at the moment is development of some of the complex clinical phenotypes that we will need to develop together to run those analyses, and of course, finalizing protocols and creating executable packages and so on. In terms of capacity building, this is really our focus for the next 9 months or so, is to really highlight and come up with a structure for our capacity building program. And one of the ways that we've been approaching that is to map learning personas, people who are interested in OMOP, and they might be people like clinicians, database programmers, the health system regulators themselves. So working out who are the people who want to engage with OMOP and OMOP data, and then working out what their learning pathway would be and helping them through that training journey. So that we're sort of using a complex framework for developing our capacity building program, which is exciting. We are doing a lot of work with Data for Life at the moment, and looking at tools for building an Arden portal, similar to the Eden portal, where we'll have data discovery functionality, data quality assessment results, and so on, and all of our artifact management in terms of our the artifacts we create for our use cases and our training programs. And we're also doing a lot of consultation across the states around how we harmonise our data governance so that we can enable the distributed analyses to work seamlessly according to different governance requirements and ethics requirements across the states, which are all very different. So we're trying to harmonise all of that. And we're very lucky to have Dr. Liana from the NIH in Malaysia, who will be visiting us for 2 weeks from next week, and we'll be learning from her about the Malaysian approach and incorporating trusted research environments for OMOP analyses. So excited for that. Just really quickly, I won't go through them all, but we have 5 different use cases that are being developed to demonstrate the value of the work we're doing, and they are very varied, but all very exciting, ranging from looking at emergency admissions for diabetic ketoacidosis, all the way to looking at, characterization of people with sepsis in hospital. So we're touching a lot of different clinical areas to really demonstrate the value of the work we're doing. Lastly, like lots of the other nodes, we're really working towards national adoption of OMOP. There are 2 large integrated national data assets that the government are creating, and both of those data assets are doing demonstration programs at the moment on OMOPing that data, and we're working with them to help facilitate that. So that's really exciting. That will be whole of Australian data sets able to be, analysed with OMOP. And recently the Australian Government Digital Health Agency wrote that OMOP is the standard for longitudinal analysis in Australia in their new national framework for digital health standards. So that was great to see recognition at the government level. And that's me. Thanks.
Wow, that was great. Like a national approaching.
Yeah.
And yeah, a lot of work's done. Thanks, Nicole.
Thanks.
You guys are all humble about this, I think. And next we have Fook. You don't have to be afraid, Fook. It's all right, everyone's. You're muted.
I'm being very
I think.
afraid.
You don't have to. You don't need to. Yep.
You see my set screen?
Yep.
Yep. Okay. So yeah, there is pressure, and I can see like most of the regional chapters going too far. Our Vietnamese chapter is just a very like pressure and learner from every regional. So here is the Vietnam chapter members. Like, since we have like some members, it's very actively they contribute to the progress. From like Alice, me, and other Dr. Chung, Natalie, and like some of the students from Jason in the Taipei Medical University, and some of the external who's working like very hard to contribute and try to mapping and working on the ETL progress for Vietnam chapter. So based from our EMC electronic medical records database, we are working under the mapping progress. So here, like we try to break out the progress into 7 steps, but I think we just like in the middle of it. For the mapping vocabulary, so we have the national core system is also very complicated. So we are working on those kinds of the progress for the conversion to the AMAP CDM. And some of other works from us is working on the book of the OHDSI translation for the Vietnamese, because I believe that with the Vietnamese version, it can help to viral and like to get like more and more people reach out to the OHDSIs and learn how to work on the OHDSIs study. And the second thing is about the value studies in our members is contributing across the study, and I hope that like we will have like further like works in the future. So that's a very short update from our Vietnams. Thank you.
Thanks, Fook, and thanks for your efforts for our the value study. Thank you. So we have Steve left for the chapter Malaysia, but yeah, Jason, your hands is raised. Do you have anything to say? No? Yeah, Steve Young from Malaysia, he said he's gonna present, but he's not here today. So I think we'll just I think we have like 15 minutes, but do you think we can just call for the APAC regional chapter updates for this? Anyone who wanna give more feedbacks or comments? This one's not. Yeah, let's go close. And so my impression of 2026 APAC regional updates, I think I heard a lot of like the progress within each country has been really great, but the like cross country exchange and collaboration looked really epic and active too. So that was really good, I think. And okay, so now I think we will share about the value study. I'm not sure who's going to present for the interpretation session.
I can present, and I'll share my screen, but Fook is online, and much of this the results are due to his efforts. So thank you so much, Fook. And I think Jack's online as well as Septi. So everyone can join in, but I'll share I'll share my screen. Okay. Let me. All right. So thanks everyone again for all of their efforts in helping to progress the value study. I think most people online will know what the value study is, but it is a global characterization study of valproate utilization and exposure among men and women of childbearing age. So the reason we are doing this particular study is because, again, that word value comes up. We want to show the value of working together as a community to answer questions, clinical questions that are of importance across our region. And so keep that in mind as we go through some of these results. It's not just the results we're interested in. It is really the process that we use to get those results and how we can now springboard off of these ways of working together to do some other really exciting work and to, again, show value of our collaboration. So the first thing is we have a finalized protocol that is available for folks to look at in the APAC Value Teams channel. So I know that there's a couple of just small queries that we need to sort out, but it's fairly well finalized. So please go and have a look at that. If you have any comments, let us know. I think, Jack, you've locked it, but if you have comments, please please email us and we can take them into consideration. So the main idea.
I was just going to interrupt Nicole and say that it's unlocked for now, just to address those couple little issues. So
sure.
If anyone has any other pressing needs, jump in as soon as possible.
Yeah. So I'm just scrolling down. You can see there's lots of work that's happened here, but just scrolling down, keep scrolling down until we get to here we are. Okay, so the main point here is that we're looking at a cohort of people, very simply, who have had a drug exposure of valproate. And we want to know of all of those people who initiate valproate, we want to include them in our cohort. So it's a very, very simple inclusion criteria. And what we're doing from that very simple cohort is then subsetting that group by age and gender to look at those the use of valproate across the ages and the gender, but then also subsetting by clinical condition. Chan.
Oh, I was muted. Sorry. I just wonder, we can investigate about the prevalent user of valproate as well as incident user of valproate. I'm not sure that whether the current incidence package, provides support two different options, but we can just make this cohort as a prevalent users because just remove the limit initial events and then it works, I think.
So
does it make
book is does that make sense to you?
Sorry, Chan, I cannot get your saying. Can you say it again?
Usual in the strategies, we can characterize the, as well, prevalent users settings as well as instant user settings, based on the single court. If the court is designed as a prevalent users, because we can, we can just select the first user among the prevalent users of Atlas in the strategies, and I believe that instance package also support this option. So if so, we do not need to limit instance users in the Atlas.
Okay. Yep.
Okay, so you suggest to use the strategist to inspect the prevalent user, right?
Yeah, we can just we can define the course as a prevalent users, and then in the incidents package or in the strategies package, we can analyze two different options together.
I see. Let me figure out. Yeah, thank you.
Yeah, I will dig into this issue.
Excellent.
Thank you,
Chan.
Thank you, Chan.
Okay, so we'll double check that this is doing the right thing. In the meantime, I'll keep progressing, but there are two things that have happened. The protocol itself, we've been developing, and Phuc's been developing the package. In the meantime, you'll remember we did a piece of work all together where we tried to understand all of the different regulatory and scientific regulatory actions that occurred around the valproate. And Bianca Varney, I'm not sure if Bianca's online, but kindly put this shiny app together, which tells us a lot about the history of all of the regulatory warnings across the different countries, different regions. And you can see here in the purple, these are all the different maternal warnings or restrictions that happened, and in the green are the paternal warnings and so on. So this was a great exercise for everyone to get together and really harmonize what happened across the world. So you can see, around 2018, lots of countries had at least one warning, and then we get the paternal warnings starting to happen from about 2023 or so. So that was a great exercise to do, and what we're planning to do when we get the results from all of the countries is to overlay some of these restrictions to see, and alerts to see what happened to utilization in response to these warnings. So that's available at in a link as well, which is on the value study GitHub. The GitHub itself is the OHDSI under OHDSI Taiwan, the value study 2026. So you can download the package after we just double check that it's doing the right thing, and you can run that on your data set, and I'm sure Phuc will guide people through the download and analysis of that package. So thanks again, Phuc, for doing all the work on that. It's really appreciated. So that's the package itself. And then I know we're running out of time, so I wanted to quickly show you some preliminary work. Now, this is not going to be the final data, but the package has been run in the Taiwan data set. In the Taiwan data set. And what Phuc has created is this shiny package that allows us to look at the results. So if I ingest the results, we can see that the results are now populated for the preliminary run of this analysis. And looking at prevalence here. We get, over the years, the number of patients who are included based on valproate prescribing and so on. Sorry, I'm just going to move this out of the way so I can see you. And then if we look, I don't think we've got the results. Oh, here we are by gender as well. So we can now see the rate of valproate use in males and females over time. Age group, we haven't got the plots there yet. And here we are. Here's the results on a plot for both males and females over time. So you can see the results here. We've got sort of higher use of valproate in the males compared to the females. And if we look back at the Shiny app, where are we? Back here in Taiwan, we really, didn't have any warnings for the paternal valproate use. So it'll be interesting to see what happens in some of the other countries, whether there's been changes over time for those countries that did have quite significant warnings and restrictions in use. So I'm not sure, Fook, is there anything else you wanted me to look at? We can look at characterization, for example, looking at the age groups and the percents in the age groups, the comorbidities for the patients in our cohort, percentage of females around 47%, and the percent with some of these different comorbidities. So yeah, Fook, is there anything else you'd like me to demonstrate?
I think that's okay, because like for the democynia, I put like up to 6 affiliations. So if like the database, the database data partners, they can like generate or can execute using the package. They can like looking at like different version or like looking at like different size database to see the variation across the country. Yes.
Great. So Jiwon, that's a very quick overview. We've only got 3 minutes left. But I guess the point is that it would be really great if people have access to data that they would like to contribute to this study. Please let us know. We've got some collaborators already signed up to run the package, but if there are others online that would like to participate, let us know and we'll make sure you get access to the package. And we are hoping that we'll be able to present these results at the symposium in Korea. So we have a time limit. We need this done as soon as possible so we can have those results.
You need to hope, you should present
We
that.
will. 100%. Okay, we will. Jason, would you like to?
Yeah.
Yeah,
Jason?
so because this study was just follow and based on the previous article made by the, Europe, and then which was focused on the woman only, but that is early. But now we move forward and to see how the drug was used for both woman and female and male. And then there are 2 aims for our study. One is to see the utilization of valproate among different population by age, by gender, and then over time by calendar years. So this should be the prevalence use of the valproate medicine. And then the M2 is about the characterizations, about how what kind of people may have a chance to use the valproate. So in this case, we can use both preference or incidence perspective to see the categorization of the baseline of users, and this is M2. So based on our M's, we can have the research design, and actually this is not outcome research in the beginning. For the outcome research, maybe we will do the future study, like an outcome study, to compare different groups. And in that case, we can have a different design later on. Yeah, so just share some my point of view for you guys. Thanks.
Yes, Jason, you make a very good point. This is really a characterization study at the moment, and as I always say, they're just as valuable as the outcome studies to understand how medicines are used, where they're being used, are they being used appropriately, is very much an important scientific endeavor, like a fancy cohort study doing comparative effectiveness. So yeah, thanks for clarifying that, Jason.
Okay, thanks, Nicole and Jason. As you guys mentioned, it is really meaningful stuff for the community, that like what we have done before, like that we are doing something that we haven't been done before. So it is great to get more data sites involved. So also big thanks to all the APAC chapter leads for today to sharing the progress. I understand how you guys are humble, but we really made applied the real big steps. So very excited to moving to develop and more like get things together more. Yep, and thank you guys for the meeting today, and I will see you guys next month. Bye-bye.
Bye.
Thanks,
Thank you.
everyone. Bye.
Bye.